Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, as you know, you've still got kids in school. Well, heading back is a big deal for a lot of kids, and it's common for some kids to be a little, well, let's say apprehensive. But if those feelings of anxiety and or depression don't go away, as a parent, when should you become concerned?
According to the National Alliance on Mental Illness, 1 in 5 teens suffers or will suffer from a mental health condition in their lifetime. Here to discuss teens and mental health is Mayo Clinic pediatric psychiatrist. Mayo Clinic pediatric psychiatrist, Dr. Paul Croarkin. Welcome back to the program, Dr. Croarkin.
Thank you for having me.
Dr. Croarkin, always good to see you. Always glad that you come to talk to us about these difficult problems. And you deal with an interesting population, kids with mental health issues. And we all know that teenagers are moody. Fortunately, those years for myself and my wife are over, but not for Tracy.
He said it, not me.
They can be moody from time to time. And I guess the first question, what's normal and what isn't?
It's a great question, and these are challenging issues for teens, parents, and physicians to sort through, frankly. As you point out, it's quite normal for the teenage years to be tumultuous and, ups and downs as far as mood. But in general, I would encourage parents to look for are things in terms of functioning across multiple spheres of teens' lives. For example, if teens start struggling socially, academically, and are increasingly more withdrawn and moody at home, declining grades, dropping out of sports activities that they enjoyed previously, and the other big piece is duration. If this is something that goes on for weeks and weeks, it's much more concerning than as you pointed out. It's natural to have bumps and concerns early on in school.
It's hard enough for an adult who has got years in the rear view mirror to say, well, there's ups and downs and, depressed and not depressed. But for a teenager who's just coming into their own awareness, their brain developing to this point, have never experienced anything like this before, what do you say to them so that because I'm sure lots of teenagers are listening to us right now, but what do you say to them when it's okay if you feel this, but not when this starts to happen?
It's a good question. In general, extremes in mood, changes in things like sleep, weight, appetite, any kind of suicidal thought, and we do know another staggering statistic is that 1 in 5 high school students will actually have those kind of thoughts at some point in their school.
1 in 5 will have suicidal thoughts.
Exactly, which is pretty staggering.
20%.
Yeah. And the other thing to drive home that's maybe a bit tangential to your point, but the stigma around these diagnoses and these problems. We encourage parents and teenagers to think of depression and anxiety and other mental health or psychiatric problems as they would of any other medical problem like asthma or a broken bone. In that you if things are severe enough, you need to seek help, need to see a physician, and they're treatable, addressable problems.
You brought up the issue of suicide. Is it more common than it used to be among adolescents?
It's a complex issue, but yes, there is consistent evidence and suggestion that the rate has increased. For example, we know now, sadly, that it's suicide is the second most common cause of death among teenagers, coming in after accidents only. So again, it is increasing, and we're doing our best to figure out why and how to address this as well.
But you don't know why. I mean, there are theories, I am sure. It's a different world. Does social media have anything to do with it?
Oh, that's a fascinating and complex question. The honest answer is we don't know. There are a lot of concerns around that. In general, we try to advise parents on social medias, and teens, in the same way we would in their interpersonal relationships in terms of stress management and seeking out moderation and healthy interactions on social media. And it's very important for parents to be attuned to this, and it's often a delicate dance in respecting teens and their autonomy and their independence and their need to grow up with the dangers that are out there in terms of negative negative interactions or stressors online.
What about anxiety? Is anxiety a bigger problem, or is depression a bigger problem?
In general, that would be could be a long academic debate, but in general, we mood disorders as a whole are probably more common. We probably under-recognize anxiety disorders, in fairness.
What does that look like in teenagers? Is it the same as adults?
It can look the same. Other differences are often when teens are irritable, that's a sign of anxiety, and that's commonly missed because it's just a moody, cranky, rebellious teen. That can be a sign of anxiety. School attendance is something to pay attention to. If your teen or your child is having difficulty getting out of bed and going to school, often that can be a sign of different types of anxiety as well. And again, sleep problems, changes in appetite, other physical symptoms as well, headaches, stomach aches.
Something that I think the last time Dr. Sawchuk was in here, he spoke with us about skills and not pills. So maybe skills and before pills or something along those lines, which has really stuck with me because I think maybe sometimes people don't want to talk about it or work on things because it's painful and it's easier to just take a pill. Is that a direction that you work with kids too when it comes to skills?
And it's an excellent point. In terms of treatment, in general, we can even start, I think, a little bit before skills in terms of what I call lifestyle treatments. Things like, regular sleeping habits, no small feet for teenagers. I know, same bedtime, same get-up time, healthy peer relationships, structured lives throughout the week, healthy diets, avoidance of all tobacco, alcohol, street drugs, and interestingly, daily exercise. We know now that actually there's really good evidence that neurobiologically that's very good for your brain and probably protective and a treatment for depression and anxiety. But getting to your point, yes, we do think things like cognitive behavioral therapy, they've been shown to be very effective for both anxiety disorders and depression. I would not to plug medications too much, but I would encourage parents not to shy away from that or be afraid of that if that's something that is recommended.
One thing that has never made a lot of sense to me is that I know that you use, or I think that you use, the same kind of medications whether you diagnose anxiety or depression, and the two seem so opposite to me, but there must be some relationship there.
You're correct. In general, we use what are called selective serotonin reuptake inhibitors, and we do know that those are effective for both depression and anxiety. In kids, interestingly enough, they're probably a little bit more effective for anxiety than depression when you look at large studies. And that speaks to the complexities that we mentioned earlier, and we have a diagnostic system where we identify these problems. It's very complicated, though. Human beings are complicated in that in some cases it's not depression or anxiety. It's a diagnostic entity that encompasses both.
We have about 30 seconds left. What should parents do if they're worried about their child's mental health as they start another school year?
As we mentioned, encourage the healthy habits and carve out time every day to spend time with their child and talk to their child. And if there are any concerns, reach out to their primary care physician or psychiatrist or psychologist.
All right, perfect. We've been speaking with Dr. Paul Croarkin. He is a pediatric psychiatrist at the Mayo Clinic. Thanks so much for being here, Dr. Croarkin.
Thank you, Dr. Shives.